Hey, my name is Dr. Cozy. It's really nice to meet you. Really quickly to get started, can I just have you verify for me your name and date of birth, please? Perfect, okay. Let's see. Okay, so you were referred here by your optometrist because you've been having chronic headaches, double vision, and confusion, and the headaches are always in the same place. Okay. Okay. Are the headaches constant? Is there any break? No? Okay. Are they always at the same intensity? Do they become migraines? Sometimes, and you still feel it in the location? Okay, can you point to me where? Okay. Do you have any ocular migraines or any kind of auras? Any feeling of like pressure in your skull, or do you ever hear like a whooshing sound in your ears? Okay. How about like a pulsing in your vision? Okay. In the morning. All right. Does it completely disappear as the day progresses, or is it... Okay. Around, okay. So a couple hours after you wake up, it starts to go away. Any history of seizure? Have you ever been tested or had an EEG done? Okay. And can you tell me a little bit about the confusion? Okay. How frequently does that happen? Okay. And is there any of that whooshing, pulsing, or any increase in the headache during that time? Okay. And can you tell me a little bit about your double vision? For example, are you seeing doubly vertically, horizontally? Vertical? Okay. Is the doubled part, is that the same intensity? Is it sort of faded, like a more faint version? Okay. And is that pretty constant with everything you look at? Is it when you look more like at a screen or printed text or both? Okay. And that's constant. Okay. Is it worse at any particular time of day? Like worse in the morning or after exercise or at night? So that's also the constant. Okay. Okay. Do you take any kind of preventative or abortive medication for migraine? Okay, you take Nurtec. Do you have any side effects with that? Okay. How often are you taking it? Okay. Yeah, we definitely encourage patients, if you're taking it as an abortive, to limit your medication days because it can cause rebound headaches for some people if they go beyond. And last question is, have you had any imaging done of your head, eyes, neck? Okay. Was that with or without contrast? Let's see if I can get a copy of those films sent here. Okay. So to start, I would like to do a quick vision test with you. I'm not interested in knowing if you're farsighted or nearsighted. It's more along the lines to see how much the double vision is disrupting your ability to see. So I have this little handheld chart here. Okay. So first, can you read for me these two letters? How about below it? And below here? Okay. How about these? So that's where it starts to be disrupted. Okay. So then I'm going to use, there's a little pupil gauge here at the bottom. I just want to measure your pupils to make sure that they're equal, okay? So do your best to keep your eyes open for me. They're pretty equal. That's good. Okay. Do your best to keep your eyes open, okay? I'd like you to direct your gaze right there in between my eyebrows. Alright, now enough with the bright light. Just like you to follow my finger, okay? Don't move your head at all, just use your eyes. Good. Now without the light, I'm going to move a little bit more quickly. Good. Any dizziness or discomfort? Okay. Excuse me. So, may I have you smile for me? Perfect. Hold that. Okay. And now I'd like you to frown and really furrow your brows. Okay, relax your face. And puff out your cheeks for me like a fish. Okay, you may relax. I don't know if I'm having reflux or what today. The joys of aging. Alright, I'm going to look inside of your eyes for something we call papilloedema. It is one of the ways we can identify things like intracranial hypertension, which is when there's an increased amount of fluid in the brain that can contribute to double vision and headaches. I'm going to be getting really close to you, okay? So I apologize for the brightness of my light here. Try to do your best to keep your eyes open. It's totally fine that you're blinking. Other side. You're doing great. I know this isn't the best feeling. Not seeing any papillary edema, which is good, but we will be ordering some imaging to completely rule that out. So now we're going to do a bit of a hands-on exam. I'm going to be palpating your head, your cranium, the back of your neck, looking for any kind of nerve impingement, as well as some points on your face and your jaw, okay? Okay. If at any point anything is tender or uncomfortable, please let me know. It's very helpful information. So, actually, let me find, there it is. Helpful if I can make myself tall. So this is the point where you're feeling the headache mostly. Okay. And you said it moves over into this region a little bit. Okay. Is there any kind of discomfort when I press here? Here. How about there? Now feeling the back of your neck. Any tenderness? Okay. to be pressing on the corners of your jaw. Can I have you open and close your mouth for me as wide as you can open? Good. Close. And again. Okay, relax. Not feeling anything on physical exam there. I'd like to take a look inside of your ears, and while I'm looking in your ears, I'm also going to conduct a bit of a hearing test. And, oops, let me move this cable because it got loose. There we go. All right. Inside of your ear looks nice and clean. No evidence of any fluid or irritation, which is good. Tympanic membrane is intact. So I'm going to whisper a series of numbers, and I'd like you to repeat them for me, okay? 27, 36, 62, 19. Good, okay. So your eardrum on that side, oops, is vibrating appropriately to stimuli, so that's good. So now let's check the other side. Okay. Side looks good too. Nice normal color, no inflammation noted. Not seeing any fluid or irritation. So I'm going to give you another series of numbers, okay? $78, $34, $56, $7, going to take a look at the external ear, okay? Okay, so now I'd like to test your coordination. So what that means in this case is I'd like you to touch your nose, touch my finger, okay? Okay, so let's go nose, finger, nose, finger. Okay. All right. So now I'm going to hold my hands up right here. Okay. I want you to push against my hands with your hands. Don't let me move you. Good. Now I'm going to try to pull them towards me. Don't let me. Good. So now I want you to try to kind of push your arms out like chicken wings. Don't let me. Good. All right. Now I'm going to press against your knees. I want you to try and open your legs against my pressure. Good. And now try to push your knees forward against my hand. Good. I'm going to try to pull your legs. Don't let me. Excellent. Okay, you can relax. So now I'm going to be testing for some facial numbness, okay? We're going to do it with two different textures. first I'm going to be just leaving my applicator in the wrapper, and then afterwards I will remove it and we will use that. So let me know when you feel this make contact. Good, okay. Good. 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 I know it's a little funny. Good. Mm-hmm. Good. Alright, so now we're going to do this again using my applicator directly. Good. Okay. Good. Excellent. And good. Okay. Can you tell me what this smells like to you? Yes. It is orange. How about this one? Yes. Peppermint is correct. This one. Yep, lemon. How about this? Vinegar, correct. So what I would like to do is order you a series of different scans, okay? I'd like to do a repeat head MRI with and without contrast, as well as an angiogram of your neck and a scan of your eyes, to rule out the presence of a clot, any kind of aneurysm or mass that may be present, and also to really get a picture of whether or not there is excess spinal fluid in the brain, if there's edema present, and rule out a few different syndromes in the process. So I will also be ordering you an EEG as well. This is to rule out whether or not you are having seizures. There are different kinds. Not all of them are associated with the shaking that most people are familiar with. For example, there's something called a focal seizure where you may even be able to talk and interact while you're having it, but that might account for the confusion you're experiencing. It may not, but I feel like it's worth adding to the list. And we do that in the clinic, just in a different part. So I will have our scheduling desk contact you once we take a look at the schedule and see what our availability is. And they will be contacting you about the MRI and angiogram as well. Most likely they'll be able to do that all in one day if you want. Some people do prefer to split it up. It depends on how comfortable you are. If you do it all in one day, the process can take about 1 to 2 hours. Shouldn't be more than 2. The scans themselves will take 1 hour, but you'll also need to have an IV started, and we'll have to get you changed, wand you to make sure there's no kind of metal anywhere. A lot of brands these days actually put things like copper and zinc and silver in their fibers because they're moisture wicking. So we always like to double check that nobody's going to have anything that's going to leave them injured. And let's see. I know in your last MRI you did not have contrast. Have you had contrast in the past? Okay. And I'm not seeing any allergies on your list. Okay. So just like pollen and dust mites. All right. That's not an issue here. So let's get this written up for you. Okay. This phone number I have for you right here, ending in 2093, is that the phone number I should give to our scheduling desk? Okay. Is it okay for them to leave a message? Cool. All right. So I'm going to pass this along to them, and they will get the ball rolling. In the meantime, do you have any questions for me? Okay. Well, if you think of anything, please don't hesitate to give me a call, okay? Okay. It was really nice to meet you, and we will get this sorted out for you, okay?